First to the United States. The first doses of COVID-19 vaccine there have been administered. On your screen coming up is the moment when two health workers in New York received the Pfizer vaccine. The medics belong to Northwell Health, which is the city's largest healthcare provider. With this, the largest inoculation program in history is officially underway. The New York Governor, Andrew Cuomo, attended the vaccination procedure virtually. The two medics said they were hoping to set an example by taking the jab themselves. The vaccination also began in Pittsburgh. Health workers were administered Pfizer shots at the University of Pittsburgh Medical Center. UMPC nurse Char became the first health worker in Pittsburgh to receive the shot. President Donald Trump celebrated the moment on Twitter. This is what he wrote. Congratulations, USA. Congratulations, world. Even as he cheered the first dose, Trump was setting in place a plan to delay shots for his White House team. Trump's team was to get the vaccine in the first 10 days, but the president later announced that White House officials will get the shot later on in the program. Joining us live on the broadcast is Amesh Adalja, a senior scholar at the Johns Hopkins Center for Health Security. Thanks very much, Amesh, for joining us. Your assessment of the preparedness in the United States for this vaccination drive, when it comes to storage, when it comes to the distribution plan.
So this first tier of people that are getting vaccinated include healthcare workers, nursing home residents. That's a little bit easier. Where we're going to see the problem is when we're trying to vaccinate the general public and people who live in the community, because this Pfizer vaccine does require extreme cold storage. So it's easy when you can have it at a hospital where they've purchased those refrigerators that can keep it at -70, -80 degrees centigrade. But it becomes much more challenging when you're in the community. And we want to make sure that the state governments, the local governments have the resources and the funding to be able to do this. Hopefully this will go off without a hitch, but there likely are going to be problems and we have to be prepared for them.
Right. If you can delve deeper into those hurdles that lie ahead, this of course has been a moment that the entire world has been closely watching. Help us better understand what you see would be the immediate challenges.
The immediate challenge right now is getting this vaccine into the arms of Americans. What we're doing in the United States is a prioritization protocol. So first it's going to be healthcare workers, nursing home residents, then it will start to be essential workers, then it's going to be community dwelling people with high risks. So this is what the challenge is going to be, is the states actually notifying the population that the vaccine is ready, that it is their turn to get the vaccine, making sure people come back for the second dose because this is a 2-dose vaccine. Making sure that the cold chain is kept intact because we don't want the vaccine to become non-viable because the cold chain hasn't been kept. And then the biggest challenge likely is going to be persuading people that this is something that they should do, that the risks for this vaccine are outweighed by the benefits. And that's going to be something that's hard to do because we want to get as many people vaccinated as possible so we can put this pandemic behind us.
How concerned are you, given the side effects that have been reported in several parts in cases where the vaccine has been administered?
I'm not concerned about the side effects that we've heard about or even the 2 serious allergic reactions that occurred in the United Kingdom. This is a vaccine that I wish I could be getting today with some of my colleagues at the University of Pittsburgh. So this is something that I think is going to be a very safe and efficacious vaccine, and I would be glad, and hopefully I will, by the end of this week, be somebody that is vaccinated.
Amesh Adalja, appreciate very much for joining us on the broadcast with those perspectives. Thanks very much.